Welcome to the deep dive. Today we're looking at something really central to India's development, especially important, I think, for UPSC aspirants listening in. It's about healthcare data. India generates a huge amount, right? But how we govern it is, well, it's complicated.
It really is. And there's this core tension, this confusion that a recent piece in the Indian Express highlighted quite well.
Which is?
Are we treating this data primarily as, part of someone's identity, something deeply private? Or is it also potentially an economic asset, a kind of property?
Okay. Identity versus property.
Yeah.
And getting that distinction wrong, that's the main hurdle.
That's the argument, yeah. This confusion can really block innovation, value creation, even basic knowledge discovery. It affects policy across the board.
Let's focus on healthcare then, as the article does. What's the situation now with healthcare data in India?
It's quite fragmented. You've got, say, large private hospitals, many with pretty advanced digital record systems.
Yep. Okay.
Then government hospitals, they're catching up, digitizing, but maybe systems aren't always talking to each other yet.
And the rest, where most people actually go.
Exactly. The vast majority visit smaller private clinics. And there, very little digital infrastructure, often paper records, if anything, and crucially few incentives for them to, switch to digital.
So this digital divide, what are the actual consequences for patients, for the system?
Well, for you as a patient, it means your medical history isn't easily portable. You see a new doctor, you're often starting from scratch. It's inefficient, potentially unsafe.
Yeah, I can see that.
For health insurers, it makes risk assessment and pricing much harder. They don't have a clear picture.
And for research, that seems like a huge missed opportunity.
Absolutely massive. Researchers, AI developers, they need large anonymized data sets to find patterns, develop new treatments, improve diagnostics. That's severely limited right now.
Okay, so the government must be trying to address this. What about the Ayushman Bharat Digital Mission, the ABDM?
Yes, ABDM is the big government push here, run by the National Health Authority. The core ideas are sound, putting the citizen in control of their health data.
Okay, citizen ownership.
And making systems interoperable so data can flow securely with consent between different providers. Think of it like building the digital roads and the rules for traffic.
Roads, rules, consent management. It sounds good on paper. But the Indian Express piece suggested implementation is tricky.
Very. The biggest challenge, perhaps, is showing the value at the point of care. Why should that small clinic invest time and money? How does the patient directly benefit from sharing data right then and there?
Right, what's in it for them immediately?
Exactly. And this is where that data as property idea gets interesting. What if citizens could somehow benefit economically from sharing their anonymized data?
You mean sell their health data?
Or share it under specific terms, anonymized, of course. The idea is this could create incentives. Maybe clinics get a small fee for helping facilitate secure, consented data sharing for research.
Okay.
Maybe patients are more motivated to keep digital records if there's a potential future benefit, even a small one. You might see new businesses, data intermediaries, emerge to manage this safely.
It's a very different model from, say, the US or UK. The article mentioned those.
Yeah, it did. The U.S. has HIPAO, which is more about patient access to their records, not really designed for this kind of value sharing. Big companies often monetize de-identified data anyway, without direct benefit to the individual.
And the UK.
The UK has the NHS, a large publicly owned system. Data governance is more centralized there. Neither model really fits India's situation, which is, heavily privatized and very fragmented healthcare delivery.
So trying to copy those models wouldn't work. What's the proposed path forward for India then?
It has to be citizen-centric. Empower individuals. Let them treat their data as property they control, alongside strong privacy rights.
How do you ensure privacy in that scenario, though? That sounds like the biggest risk.
Crucial question. The suggestion is strong safeguards. Things like robust anonymization tools may be provided as digital public goods like open source software everyone can use. Plus, digital forensics, transparency tools, so misuse can be tracked and penalized.
Okay, so empower the citizen, but build strong technical and legal guardrails.
Precisely. It's about shifting away from maybe just importing Western data protection ideas wholesale and creating something tailored to India's context, something that unlocks economic potential while respecting privacy.
So for our listeners, particularly those focusing on UPSC mains or even prelims, the key takeaway here is
it's understanding this dual nature of data. It's about identity and its potential economic property. Recognizing both, And building governance around citizen control for both aspects could be vital for transforming healthcare and maybe other sectors in India.
Which brings up a fascinating point to ponder. If this citizen-centric data as property model works for healthcare, where else could it be applied in India? Education, agriculture, finance.
And what unique challenges would pop up in those sectors? That's definitely something worth thinking about.
Absolutely. We hope this deep dive, drawing from that article in the Indian Express, has given you valuable insights for your preparation.
Yeah, I hope it was useful.
For more discussions like this on key current affairs topics, do like, subscribe, and please add your questions or thoughts in the comments. We do read them. Thanks for joining us on The Deep Dive.